guys, as you heard, I'm Jill. I kind of recognize some of you guys from just walking around. And I am working on my master's at Clarkson. So I guess today we'll just kind of dive right into dermatology. And to start off, on your PowerPoints, I left some spaces blank. And throughout the PowerPoint, you can just kind of fill them in, keep you guys awake early this morning. And then at the end of your PowerPoint packet, there's also a quiz that we can do at the end. We can do it together, you can do it by yourselves, you can get together, I don't care. We'll figure it out at the end. So, this is just a visual for you guys to kind of get the picture of what a normal skin cell, or not skin cell, but skin slice looks like. We start with the top, the epidermis, we move down to the dermis, and then the tissue at the bottom here, and then just kind of some random little tidbits that I liked in this slide where you can see like a sweat gland, you can see the nerves, oil. So it just kind of gives you, I think, a full picture of what a normal slice of skin should look like. So this right here, as we go through, I wanted you guys to kind of see what some of the reactions are that we're going to be talking about. This is actually somebody's stoma that is severely inflamed. They must be having a serious reaction to, I don't know, the adhesive maybe on their wafer, but that just does not look good. This one, I thought maybe like some flip-flops gone bad, you know. I'm not really sure what's going on. But again, allergic reaction to some sort of compound that's in the makeup of, I'm assuming, the shoes that they were wearing. This guy, I don't know if you guys get many claims from California, but we do, and I don't know, we get loggers, and this guy just kind of reminded me of some backwoods, up in the mountains kind of guy. But that is some serious poison, ivy, oak, something. Latex allergy. I suppose maybe if we have a claimant that's a cleaner or some sort of environmental worker, they would have gloves on and you would maybe see something like this. Shingles. I'm not really sure when we would see this, but nonetheless, shingles is very painful, requires medical attention, so we'll go over that one. Sunburn. I would hope they would know to put on sunscreen, but you never know. Ringworm, visual of that. This one's pretty easy to spot. I would think that, you know, if they have any sort of Googling ability, they'd be able to figure out that they have ringworm. It's pretty distinct. Hives, and then cellulitis. And obviously, when cellulitis gets to this degree, these people need to be inpatient. Cellulitis can start off pretty slow, but it can develop rapidly and it can be pretty severe, which is obvious in this case. So, if you guys, I don't know, if you guys want to look at these pictures as we go through, I'll just set them out over here and you guys can grab them and reference back. So we'll start off with allergic dermatitis. It basically starts off, allergic dermatitis, when something that a person is sensitive to kind of triggers an immune response. And obviously it would be a skin response is where you would see it. And it usually affects only the area that's in contact with the allergen, which is the thing that would cause the immune reaction. Signs and symptoms. there can be a million. So I just kind of picked through some of the major ones that I thought were maybe the most obvious. They include red rashes or bumps, itching that can be severe for sure, blisters, draining fluid and crusting, swelling, burning, itchiness, again, and tenderness of that skin, that area, that can definitely happen. And then the severity, it depends on how long a person's been exposed. You know, if you're constantly, you know, in contact with something that your body is immune to or is triggering an immune response to, obviously it's going to be a lot more severe than if you're just in contact with it and it's gone. So definitely the amount of time that you're exposed, the strength of the substance. You know, if you're in contact with 1 part bleach, 100% water, 100 part water, that's going to be a lot different than if you're, you know, 100 parts bleach, 1 part water. And then temperature, airflow, sweating, and wearing gloves. That kind of goes back to the latex, but we'll get to that one. We'll give that its own little spot. Common allergies. A lot of jewelry can be made of nickel, and that's one that we see a lot. Medications such as the antibiotics and oral antihistamines, personal care products, skin tattooing for sure. And skin tattooing, I don't know if any of you guys have ever gotten a tattoo, but your skin is already red after you get the tattoo anyway. So that's one, I guess that I would really, if you know someone that's gonna get a tattoo or you have a tattoo, just kind of watch it. You know, make sure that that redness doesn't continue to last or widen, or, you know, just keep an eye on it. Airborne substances such as aromatherapy spray and insecticides for sure. I work in California obviously, and I know that we have a lot of farm laborers and cleaners, just anything where that aerosol is gonna be there for them to breathe in. So treatments. The key is to identify what you've got an allergic reaction to, and then just stay away from it. That's pretty much, you've got to be able to identify it and get away from it. And then in severe cases, your doctor might order some corticosteroids to kind of help with the itching and the inflammation. And then also antibiotics may be necessary if you need to fight a bacterial infection. And just an example of some corticosteroids, just so you guys have for your knowledge, cortisone, prednisone, and methylprednisone, just in case you ever hear those thrown out. And just FYI on this slide, I don't know that it was, do you guys offer medical, you don't offer advice over the phone, correct? You don't say, hey, just run to Walmart, grab some Benadryl, nothing like that? Okay, that's what I thought, but I wasn't entirely sure. So this is, I guess, then just kind of like an FYI, over-the-counter stuff. Non-prescription creams that are 1% hydrocortisone can temporarily relieve the itch. Oral antihistamines such as Benadryl might be helpful if the itching is severe. And then like Aveeno, oatmeal bath, those kind of things are also helpful. Moving on. Irritant dermatitis. This is the most popular type, common type. This is a non-allergic inflammatory reaction that occurs when a substance damages your skin's outer protective layer. Signs and symptoms, they're pretty much the same as the others. You'll see a lot of similarities as we go through this PowerPoint. Red rash or bumps, itching, dry, cracked skin, scaly skin, swelling, burning, or tenderness of the area. Am I going too fast? Should I slow down? Is it good? Common irritants, solvents, rubbing alcohol, bleach, personal care products, airborne substances, sawdust, wool dust, any sort of, I guess, outside kind of labor-intensive job. This could probably be one of the key suspects if you were to get a claim. Treatment and drugs. Again, the key is to identifying it and staying away from it. Again, same as before, in severe cases, your doctor might prescribe an oral corticosteroid to reduce inflammation, the antihistamines, again, to relieve the itching, or antibiotics to fight that bacterial infection if it should get that far. Again, just an FYI on this slide, alternative and over-the-counter treatments. Same as before, the hydrocortisone can temporarily relieve the itch. You can do the Benadryl, which may be helpful if your skin is itching severely. Sprinkle water with some baking soda. Again, the oatmeal-based, like Aveeno, I know has one. And then on the bottom here, I just thought this was interesting. It's not any sort of medical genius. But eucalyptus, camphor, I'm not sure how you say this one, calendula, and rosemary are all things that can kind of calm some of this irritant dermatitis. I know there's a lot on this slide, but we'll go for it. So occupational contact dermatitis, just what it sounds. Rashes resulting from exposure to allergens while you're on the job. Occupations and hobbies that put you at higher risk for this type of dermatitis include, like we said before, kind of labor intensive, metal workers, construction workers, things with aerosol like hairdressers, waiters. One that I thought was weird but then made sense to me was scuba divers. I guess the whole, the bodysuit, it's over your whole body if you got a sensitivity to that. Gardeners, agricultural workers, and chefs. And like I said before, I'm not sure, 100% the specifics of you guys' jobs and contact with the claimants, but I feel like we should just have like a little bit of a background of when to, say, hey, you know what, this doesn't sound right, you need to go see somebody. So immediate medical care, if you think, if it sounds like the skin is infected, or if it sounds just like, oh, that doesn't sound right. Fever, that's a huge sign of infection for sure. If there's pus, like oozing out, I mean, that's just gross. You need to go see somebody about that. Lungs, eyes, or nasal passages are inflamed and painful, maybe from inhaling one of those aerosols. That's kind of a red flag in my book. And then I'm not entirely sure how we would be able to determine this. We'd have to have a claimant that would be really, really able to describe this to us. But if a rash, if it sounds like it's damaged the mucosal lining in the mouth or the digestive tract, that would also be means to get them to see somebody right away. So, what do you think on these ones? I'll let you guys read them, and you can tell me what you think.
Do you have dermatitis?
The first one,
Or it's allergic?
Yeah, I think that would work. Mm-hmm. And then, I think occupational would work as well. What about number 2? This one would be what signs and symptoms are we looking for?
Rash, bumps.
Mm-hmm. I mean, really, the signs and symptoms of both kinds are very similar, so. Yeah, bumps, skin tenderness. I guess we could go even so far as to say swelling in a severe case. So yeah, nice work. Alright, so up next, poison oak, ivy, and sumac. And this is something that I did not know, so if you guys knew this, good for you, but it is not actually the plant itself, but it's the oil that you come in contact with that will cause the symptoms. And I'm not gonna lie, I'm not entirely sure how to say this. Madeline, how do you say it?
Urushi oil? Urushi oil.
Okay, that works.
Urushi oil.
Okay, so we'll say that. It's the oil in the poison ivy, oak, and sumac. You find this oil in all parts of the plant, and it's in the leaves, the stems, and it's even in the roots. And within minutes of contact with that oil, that's when your skin will start to absorb it, and then you may not see a rash right away. It might take a week or so to appear, but it's the oil, not the plant. Which, I don't know if any of you guys went to day camp, but I always thought it was the plant. Apparently it's not. It's the oil.
It's the old saying with poison ivy, leaves of 3, let it be.
Mm-hmm. Yeah, something like that, yeah. Okay, so symptoms. Itchy skin, redness or red streaks coming up from the skin, swelling, an outbreak of small or large blisters, and then also after the it's kind of cleared up a little bit, you'll get like some crusting after those blisters have kind of popped and burst and oozed and done all their nasty things. Okay, so the rash will continue to appear on new parts of the body, which is another part that I did not realize. The rash will continue to show up on other parts of the body that get in contact that actually touch that oil. So you yourself, if you're touching the area, you can spread that oil on your skin, and you can touch other parts of the body and therefore spread the rash. So don't touch it. I know it's hard because it itches, but don't touch it. However, good thing to know is you cannot give the rash to someone else. Even if that person touches the rash or the fluid from the blister, I don't know why they would, but that person can't get the rash. The person has to actually touch the oil to get the rash. Does that make sense? Is that good? Okay, a lot of info here. thing to take away from this is there's 3 ways to get the rash. Direct contact, by touching the poison ivy, the poison oak, or the poison sumac, you can get the rash. The indirect contact, that oil can stick to almost anything. So let's say, you know, you let your dog out, you touch the dog has oil, get the rash. And then airborne, I didn't know this one either. Burning the plants releases the particles into the air, and the airborne particles can land on the skin. So, just stay away. Stay away. Immediate medical care. If you have trouble breathing or swallowing, you're probably having a severe reaction and that needs immediate medical attention. If the rash is just overtaking you, if it's on most of your body, you probably need to go see somebody. If you experience any swelling or if your eyelids swell shut, no good. You need to go see somebody. On your face or on your genitals, you need to go somewhere. And much of your skin itches, or if much of your skin itches and nothing you're doing seems to ease that itch, you need to go see somebody and figure out what's going on. So critical thinking question on this one. You guys can read it and see what you think.
No, because the hedgehogs come in contact with the oil themselves, not by the signals.
Yep. Very good.
Among the 3, is there one that's more severe than the others? Sumac versus ivy versus...
Not that I read anywhere.
Pretty much the same.
Yeah. I guess it just kind of depends on your sensitivity to it. But yeah, nothing I read says one is worse than the other. Do you guys have any questions? We good? Latex allergies. And I'm not sure, I know this was, when I was in the hospital, this was a huge issue, latex sensitivity. And like I said earlier, I'm not sure when we would really see this besides maybe like some housekeeping claimants or something along those lines. Something with chemicals, and I have gloves on, but anyway. Latex allergies. It is a reaction to certain proteins that's found in the natural rubber latex, a product made from rubber trees. If you have a latex allergy, your body mistakes the latex as a harmful substance, and that's when you get the reaction. Latex allergies may cause allergic reactions ranging from skin irritation, you know, our standard bumps, bruises, red skin, or not bruises, but bumps and red skin, tenderness, all the way to anaphylaxis, a potentially life-threatening condition. Are you guys aware what anaphylaxis is? Like anaphylactic shock, anaphylactic allergic reactions? Yeah? No? Okay. Okay. So if you're allergic to latex, you will react after being in contact with the latex in the rubber gloves or by inhaling the airborne latex particles when someone takes off their gloves. Mild symptoms, the itching and skin irritation. Skin redness as well. And in some severe cases, you can have hives and a rash. But and then more severe, itchy, watery eyes, scratchy throat, difficulty breathing, wheezing, coughing. So just a little bit, the science of a latex allergy. In a latex allergy, your immune system identifies the latex as a harmful substance and triggers certain antibodies to fight that allergen. So then the next time that you're exposed to that latex allergy or latex, the antibodies signal your immune system to release histamine chemicals into your bloodstream to go fight that contact with the latex. Two types, direct contact and inhalation. Obviously, direct contact is the most common cause of latex allergy. It involves touching latex-containing products. I think in our case, latex gloves would be the most common. And then inhalation, we kind of said that earlier. When someone takes off their gloves and you walk into that, I guess, dust from taking off the gloves, you'll breathe in the particles and get the airborne reaction.
Are latex allergies becoming more common?
Mm-hmm.
And healthcare professionals, are they trying to get away from using latex?
Yeah, when I was at the med center, we went through a massive change out.
Okay.
All the gloves were exchanged for non-latex gloves.
Okay.
Mm-hmm. And patients too were becoming more and more sensitive. So we did an initiative where we always had to have signs outside the door, like little stop signs, like, hey, I have a latex sensitivity, I have a known latex allergy.
Oh.
And then that was just another like little reminder, like, hey, make sure you're not wearing anything that has latex.
So they wear bracelets too. Like, yeah, I worked at the med center. Like, they would have like a bracelet for every allergy.
Mm-hmm. Yep.
I don't remember we didn't have latex gloves.
Yeah, no. Mm-mm. Yeah, I was there for 7 years, and I think it was towards the beginning half that they had like that massive change out. So.
I feel like with gloves though, like not really work comp related, like even if you wear those non-latex gloves forever, your hands sweat and then you kind of get the same.
Yeah, it's like chapped
and
itchy.
red and itchy,
Mm-hmm.
yeah.
Mm-hmm. Yeah. No, I definitely agree with you. Anything else? Comments?
There's an interesting stat I came across on that, Jill, and it's CDC was behind it, and they said 2% of the general population has a latex sensitivity. Among healthcare workers, they said it was 4.5% to 21%.
Wow.
Obviously, because they were required to wear the gloves more often
Yeah,
for
for
longer
sure.
periods of time. So if you did that, probably with the general population, the
Yeah.
numbers would jump significantly.
Wow, that is quite a jump too.
Yeah, it really is.
Okay. So, like with most of these reactions and allergies, there are medications available to help reduce the symptoms. However, in this case, there's no cure for a latex allergy. Basically, what you can do is stay away. Know that you have a sensitivity and stay away. And then for less severe reactions, your doctor may be able to prescribe some antihistamines. That'll give you a little bit of relief while you're having a flare-up. Going back to that anaphylactic comment earlier, the most serious allergic reaction to latex is an anaphylactic response, which can be deadly. Anaphylactic reactions develop immediately after a latex exposure in highly sensitive people. But a little thing to note, it rarely happens the first time that you're exposed. So if anyone ever calls in or you ever hear of anyone saying any of these signs and symptoms, like you guys would know, I mean, these are pretty crazy. You would know they need to see somebody right away. Difficulty breathing, hives or swelling, wheezing, drop in blood pressure, loss of consciousness, rapid or weak pulse. These people are very sick. They need to go see someone. Critical thinking question on latex. Tell me your thoughts. Anything?
Maybe it's not the same chemicals that she used at the last place, or
That's
like
true.
the ratio that it's mixed in is different.
That's true.
There could be a lot of things, maybe it like wasn't aired out, like if
The
you're working.
anaphylaxis.
But yes, you're right. Actually, that's very true. Now that you point that out, but that's what I was going for, was anaphylactic reaction. And then, do you think she can wait till tomorrow? No, she can't. Shingles. Shingles is not very fun. Has anyone ever known anyone that has shingles? Yeah. Oh, you've had it?
No.
Or you know someone, okay. Yes, very painful. These people are miserable. This is not fun. So shingles. Shingles is a viral infection that causes very painful rash, most commonly over the torso. Although it can occur anywhere in your body, it most often appears as a single stripe of blisters that wraps around either the right or left sides of your torso. So when I was in the hospital and we would assess people, we would usually see if we suspected shingles. They would have some type of a rash that would kind of go up and around here, and then up and around here. And it's, as we go through, you'll see it's just nasty stuff. Shingles can be caused by the Varicella zoster virus. It's the same virus that causes chickenpox. I'm sure you guys have heard that. So after you've had the chickenpox, the virus lies inactive in the nerve tissue around the spinal cord and the brain. And then, as you know, mostly older people get shingles, so it can reactivate later on in life.
What triggers that?
They don't really know. The information that I found is that it's something triggers it when they have a lower immune system. Like, so if somebody's sick already, whatever that trigger is, that's when shingles will usually pop up. So
Okay.
they're not entirely sure.
Sounds like it's more common for older people.
Mm-hmm. 'Cause of the
Older
word.
people, yes, generally have weakened immune systems. People, yes, with cancer, under cancer treatment.
I don't know that
Stress, any kind of stress.
Yeah, I
really
don't know
can-
that there's one certain trigger that they know of. That's
Yeah, it can be a combination of things. And
My grandmother had it in up in Minnesota visiting her, can't give her a big hug.
Damn it, Eric, she
Oh.
punched me because she has shingles.
Yeah. That'd be that painful part, yeah. Okay, so signs and symptoms. It usually affects that that one side of the body. Pain, burning, numbness or tingling, sensitivity to touch, the telltale sign, the red rash. You can also have like fluid-filled little, like almost like blister-looking things that can break open and crust, and then itching in some people. Some other random kind of symptoms that aren't maybe so common: fever, headache, sensitivity to light, fatigue, and then pain. Pain is your number one first symptom of shingles. So, a little bit of the background on it. After you recover from the chickenpox, the virus will enter your nervous system and lie dormant for years, mostly years, older people. Eventually, it may reactivate and travel along the nerve pathways to your skin, and that is where shingles will pop up. unclear cause. It may be due to lowered immunity to infections as you grow older. And as we all know, shingles is more common in older adults and in people who have weaker immune systems. And then this, I don't know, I think this is some good info. A person who has shingles can pass the Varicella zoster virus to anyone that isn't immune to the chickenpox. Usually occurs through direct contact with open sores of a shingles rash. So I don't think this is very likely. If you know somebody that has shingles, you're not going to touch it. But in the off chance you didn't know and you came in direct contact, once infected, the person will develop the chickenpox though, not shingles. And then shingles is usually diagnosed based on a history of pain on one side of your body, along with a telltale rash and blisters. Your doctor can also, I mean, I don't know that this would really have to happen unless it was a really kind of a strange case, but your doctor can also do like a tissue scraping or like a culture maybe of a blister or pus pocket that you have there, and send it over to pathology to get like a clear-cut diagnosis if it should be kind of a questionable case. There's no cure for shingles, but prompt treatment with prescription antiviral drugs can speed the healing and reduce your risk for complications. You guys don't need to know this, I just threw this in for FYI. Acyclovir, valacyclovir, and vanzaciclovir, I think is how you say that one, that last one. Those are all antiviral meds that you could possibly be given for a shingles diagnosis. And then shingles, if the pain is so severe that people are, you know, in the doctor's office and, you know, needing something, these may be possible oral drugs that they could be given. Anticonvulsants like gabapentin, or also known as Neurontin, that can be given for nerve pain. Numbing agents such as lidocaine that can be given like as a cream or gel, and that can kind of soothe some of that pain. Good old-fashioned narcotics, codeine, and then I don't know that I've ever seen this, but an injection of a local anesthetic. Have you ever seen that, Ben? I haven't.
For shingles, I don't know. I don't
Yeah,
know.
I
I don't know if they do that or not.
I don't know that this one, that last one is all that common, but it could happen. Alternative treatments, cool bath, just kind of calm the inflammation, the swelling, the pain of that of those blisters with a wet compress. Try to reduce the amount of stress that you're having in your life because you have shingles. I don't know if that's all possible, but shingles question. This one's kind of a duh question. Yeah. Kind of a duh question. But
Is it common on the neck?
no, and that's what I
Yeah.
wanted to call your attention to this. On her neck, and then and then just other, like an area that was tender to the touch, but there was no rash on the rest of her body. And then she thought that she had like some flu-like symptoms. So it can start off, you know, pretty nonchalantly, but even if you have somebody who you think, oh, you know, it just doesn't look quite right, definitely have them go see somebody so that they can avoid the pain and the annoyingness of shingles, because It's just bad. So even if you have an inkling that it might be shingles, go get it checked out.
What's the typical time on that, Jill, for healing when someone has shingles?
I guess it depends on the time frame in which they get the antiviral. I would say maybe once they have the antiviral, a week-ish, and that's kind of a rough guess, but I would be comfortable saying like a week-ish. And I mean, they're still gonna have like kind of the crusty stuff on their skin. It's not gonna look pretty, but the pain and kind of the redness and that kind of stuff will start dying down.
So with the kids that are now getting the chickenpox immunization when they're little, are they still at the same risk, or do they actually have to have the chickenpox to be?
I think, I'm not 100%, but I think you have to have the chickenpox.
I have tried to find that out, and I think you still, you know, you're still possible to get it. I think, you know, since you're introducing the virus, you know, it's going to be inside of you, but, you know, certainly the idea is that, you know, they develop, with the immunization, they'll develop a, you know, response to it. So it would be considered, I think the way I understand it is it's considered then a mild case of chickenpox. So I don't know, that's something to be seen in years to come, whether they would ever develop chickenpox. And I'm not sure, you know, the people who do get shingles really severely, you know, if in fact they did have severe chickenpox when they were younger.
Oh, yeah, I don't know the correlation.
Yeah, I'm not sure. I'm not sure. And I'll tell you, there is a, just since I'm talking now, there is a vaccination for shingles,
Mm-hmm.
but yeah, you know, just from experience, you know, my father took it and, you know, was on chemotherapy for a long time and then did develop shingles. So it was not effective.
It's kind of like the flu, you know, you get the flu vaccine, but, you know, there's a select few that still end up getting the flu,
Yeah.
you know?
I think too, like from like my grandmother wanted to get the shingle shot, but like when you're on like Medicare A, B, C, D, whatever, like it's not covered too.
Mhm.
So like, I feel like it's not really accessible to everybody.
Which is
So-
unfortunate.
Yeah,
Where at the med center did you work?
I worked at Bellevue in the ER.
You look familiar. Okay. Sunburn. I'm just gonna get on a soapbox really, really fast. Wear sunscreen. This is so terrible. And I'm learning the hard way because now I have to go get checked every 6 months for carcinoma, so wear sunscreen. Sunburn. Red, painful skin that feels hot to the touch. Usually appears within a few hours of too much exposure to ultraviolet light. Too many hours at the pool. Intense repeated sun exposure results in sunburn, increasing your risk for other skin damage and certain diseases. It can include dry wrinkled, leathery skin. You've all seen those ladies that you're like, oh, that looks painful. Dark spots, rough spots, skin cancers, melanoma being the most serious. Signs and symptoms, pretty obvious. Pinkness or redness of the skin, skin that feels warm or hot to the touch, pain, tenderness or itching, swelling, headache, fever, and blisters. I'm sure we've all had that one sunburn where you're just blistered head to toe. Usually happens in springtime. You're nice and pasty white. And fatigue also. I don't know if you guys have ever had a really bad sunburn, but you get in a couple hours later and you're exhausted. So fatigue is kind of a random one, but one that occurs. There's a lot of info here, so just bear with me. There's obviously no cure for sunburn, just time. It doesn't heal the skin or It doesn't heal the skin or prevent any damage to your skin, but it can reduce the discomfort from it. So over the counter pain relievers that you can try, just get like some ibuprofen, you know, just to kind of help with that. You can also do some gels, aloe vera gel for sure. And then if it's really itching, which I guess would maybe be more towards like the peeling stage, you can do some hydrocortisone cream. And then there's also some of those hydrocortisone creams that have a little bit of like pain reliever in them that you can try if you're really struggling. So just some random over the counters. Again, ibuprofen to help control the pain until it subsides. Cool the skin, apply a cold compress, do the aloe vera, apply a moisturizer, I guess aloe vera lotion goes there, hydrocortisone cream, if you need like a coverage or some pain or some itching. If you have blisters, don't pop them. They contain your natural body's like kind of fluid and are protected to the skin that's underneath. And then also rehydrate yourself. Drink a lot of water. Kind of get it back into hydration stage. I
But
enjoy
when you
questions.
put sunscreen on, does that affect, I don't know the right way to phrase this, the amount of vitamin D you get? For example, in winter, in northern states, and people aren't exposed to
Yeah.
the sun, they can get seasonal affective disorder.
Right, sure.
So,
I don't know.
if you go out in the sun, put on heavy duty sunscreen,
Right.
are you getting vitamin D?
I think it just blocks the negative rays, doesn't it?
Well,
I've never really thought
you're
about it.
blocking UV rays, which you need for vitamin D
Okay, so that
production.
would-
Yes, it does. It does. And you're sort of your best source of vitamin D is actually the sun. So you're weighing the two.
So yeah, I guess
You know,
SPF 95.
Do you want skin
I do-
cancer or do you want,
Seasonal affective
rotten
disorder.
bones? I mean,
Awesome.
it's one or the other. People take vitamin D now, tablets.
Sure.
So,
They're
but really the
underrated.
best way to get it is from
Yeah.
the sun. So, for us fair-skinned people,
That's
it's
a good point. I've
it's-
never thought of that.
yeah, it's sort of you're at a disadvantage.
Huh. All right. Ringworm. Ringworm of the body is is a fungal infection that develops on the top layer of the skin. Ringworm is very distinct. It is a circular red rash with clear skin in the middle. It may or may not itch. There is no worm involved. And it's also, I don't know if you guys have ever had a bad case of athlete's foot, but this is, athlete's foot is also closely related to ringworm. Ringworm often spreads by direct skin-to-skin contact with a person or an animal, actually, that is affected with it. So it typically begins as a flat, scaly area on the skin that may be red and itchy. The patch develops a slightly raised border and then expands outward through the circular ring. The contours of the ring might not be quite regular, maybe kind of a little oval, loose circle, but kind of the outline of a snake or a worm. And I don't know, I've heard that like wrestlers have an issue with ringworm. I don't know if that's true. I could see how it would be true, but That's where I've heard a lot about ringworm. So there's actually 4 ways that you can get ringworm. Human to human, human to animal, object to human, and soil to human. Soil to human is obviously the most rare. Human to human, direct skin to skin contact with the affected person. I guess maybe that's where wrestling comes in. Human to animal. I guess groomers would have an issue with this, dogs or cats. And then also it's common in cows. I don't know. And then if it's on the surface of something and it has not been killed off yet, you can get it from touching that surface where it's at. And then contact with infected soil. And then your doctor, ringworm is so distinct that your doctor should be able to diagnose it just by looking at it. I mean, it's pretty obvious. And then for a mild case of ringworm, you can apply some over-the-counter antifungals or creams. Pretty much the stuff you put on for athlete's foot, like the Lomotrin and Lamisil. So, question?
Yes, it's possible.
Mm-hmm. And then you would just be looking for that circular pattern and tell her to go to the athlete's foot aisle. Hives. So hives. They're also known as urticaria. It's a skin reaction where itchy welts pop up. They can be really small in size and they can be all the way to huge, large blotches. That can be several inches actually in diameter. I had no idea they could get to be inches, but they can. The welts associated with hives can be red or flesh colored. I think the flesh colored ones are more like the blister type. They kind of look similar to a blister. Intensely itchy, kind of an ovalish shape. A few millimeters to actual inches across. And if you're lucky, most hives will go away in 24 hours. So, fast and furious. I have seen hives from food, and I've seen hives from medication. My dad has an allergy to shellfish, blew up in hives, and my sister has an allergy to penicillin, blew up in hives. So those are the 2 that I can say I've seen. Penicillin, like I said, aspirin, ibuprofen, naproxen, some blood pressure medications, I guess also can cause hives on people. And then kind of just everyday animal dander, latex, as we went over earlier, that can cause some hives. And then like bug bites or like bee stings, those can also cause some hives.
So if it's caused by a medication, does that mean the person can never take it again? Or each time they take it, will the hives break out?
I can't speak to everyone on that one. I know that my sister cannot take any sort of penicillin in the family of penicillin kind of stuff anymore. So, because she broke out every time. So, your doctor will examine your welts or areas of swelling if they're still present, and do an H&P to kind of figure out where you went wrong and figure out what your possible cause was. You can also do the allergy skin tests. I don't know if you guys have seen those, but they kind of stick all down your back. They kind of square off your back and stick you with a bunch of different stuff and see where you get a reaction. Antihistamines, though, are kind of the gold star standard treatment for hives. They reduce the itching, the swelling, and other allergy symptoms. And then corticosteroids can be used for more severe situations. They can give you a shot of prednisone, or you can take oral, I guess, too, to reduce swelling, redness, and itching. So, over-the-counter alternative treatments. Try and figure out what the cause was and avoid those triggers. Like we said earlier, an over-the-counter antihistamine, Claritin, Zyrtec, Benadryl. A cool compress again to try and calm that area. Cool bath. And then loose cotton clothing, breathability, get some airflow. Nothing that's gonna irritate the skin. So hives. Any alternative treatments that we could maybe throw in there?
Say for cold bath.
Yes. Alright, so yeah, don't wear tight clothes. Take a cold bath. Drink some oatmeal bath. That kind of stuff. Cellulitis. Cellulitis, I think, is a fun one. It's really gross. It's gooey, icky. Cellulitis is a common and can be a potentially serious bacterial skin infection if it is not addressed in the early stages. It appears like a swollen red area on the skin that feels it's hot and tender, and it can spread really rapidly to other parts of the body. And just a little FYI, heat, redness, pain, tenderness, those are all signs of infection, a fever as well. So if there's an area on someone's skin and they're like, gosh, you know, this just, it looks weird, it's hot to the touch, it hurts, they probably should get it checked out, just because that's not normal. And it can lead to cellulitis. Signs and symptoms, so swelling, tenderness, pain, warmth, fever, red spots, weird blisters that are popping out of nowhere for no reason. And then a key big red flag for cellulitis is perhaps maybe you had a red spot on your ankle. Well, then you wake up 2 days later and now your red spot is all the way mid-calf. Not normal. You need to go get that checked out. So cellulitis occurs when bacteria, most commonly the Streptococcus and Staphylococcus, enter through a break or a crack in the skin. So when you see these older people that you can tell just don't really take care of themselves, and their skin, mostly below the knees, is all cracked and discolored and, you know, just dry and just does not look right. These people are the people that are at risk for getting this cellulitis. Their skin, they just aren't taking care of it, and this bacteria can creep in through any one of those little flaky crevices. So although cellulitis can occur anywhere in the body, it's most commonly seen in the lower leg. Bacteria is most likely to enter through disrupted areas of skin, like I was saying, just cracks, crevices, dry, flaky skin. If you had a recent surgery, if you have cuts, if you have a puncture wound for some reason, an ulcer, and then, like I was saying, bacteria can also enter through areas of dry, flaky skin or swollen skin. Your skin's appearance will help your doctor make a definitive diagnosis. He or she may also suggest blood tests. A wound culture for sure is probably going to happen at some point, and then other tests to help rule out other conditions. And then just a little random tidbit that's kind of scary. In rare cases, the infection can spread to the deep layers of tissue, causing the flesh-eating necrotizing fasciitis, which is random. It's kind of scary. And obviously, this is an extreme emergency. Cellulitis treatment usually is a prescription for an oral antibiotic. With the 3 days of starting the antibiotic, let your doctor or let the doctor know whether the infection is responding to treatment, because if it's not, they need to get you switched right away, because they don't want this process to go on any longer than it has to. And then, kind of depending on the degree of the infection, anywhere from 5 to 14 days worth of antibiotics. And then this is the last critical thinking question. And lymphedema is just swelling, severe swelling.
Cellulitis, antibiotics, cellulitis.
It's all cellulitis. Trick
are
question.
you-
Oh, you're right, antibiotics. But I liked this one because it kind of showed you like how severe this could become. I mean, this guy was on, he had to go to the burn unit, he had to be on pressers, and was in the ICU, intubated. I mean, for a little bit of leg swelling, you could see how fast this can progress and, you know, how severe it can become very quickly. So key points. You're allergic and you know it, stay away from it. Very, very easy way to avoid a reaction. Use sunscreen. Benadryl is the best over-the-counter friend you can have. Benadryl will do a lot of things. Itching, hydrocortisone cream for your skin surface. Itching, antihistamines for oral use. Do not touch a brush if it looks like a ring. And then I guess this doesn't really relate because I didn't really know exactly what kind of claim of contact you had, but if somebody calls in and you have a gut feeling that it's like, this is weird, this does not sound right, just tell them to go to the ER. That's all. Good job. You just hit the red button